Sure. My name is LuAnn Brady, and I'm the Senior Vice President and Chief Operating Officer for Shore Regional Health.
And Rebecca Bair, and I'm the Vice President of Philanthropy for Shore Regional Health.
Yeah, so, when the Certificate of Need was approved in January of 2024, about 5 months later, in late June, early July, we actually started all of the work around what I'd call the site work, getting the site prepared for the building. And a big piece of that was being able to relocate a portion of Route 662. And so that happened, and that happened in the time frame that was important for not only the project, but also for the community, so that we didn't have any disruptions with, the summer travel and being able to get that back in operation before Memorial Day of this year. So, we spent about a year, July 24 to, June of 25, with the site prep and with accessing all of the permits. So we now, as people can see as they drive along Route 50, are at a point where the building is starting to go vertical. So we're putting in the footers and the columns. We have the second access road off of Route 662 into the Talbot County Community Center that will be open probably in the latter part of August, early part of September, with its base pavement, so that will allow for 2 access points off of 662 into the Talbot County Community Center.
Initial goal for capital of $50 million, and we have exceeded that goal with a very generous $25 million anonymous gift. And now we're at 62.6 actually as of today, and are moving forward to 100 million, more than capital. We always knew we would need to support the building with capital, and there's still an opportunity to add more because there's more need for capital, but also for innovation, for workforce development, and for programming. It's more than just a building. It's all of those great things that go inside that building and truly make it state of the art.
And, one of the things that it will be happening in September is one of the things that I think makes the building most unique, not only for the Eastern Shore, but the entire state of Maryland, is the use of geothermal energy for our heating and cooling. So there's about 40 acres that sit behind will sit behind the hospital property, and they're grading that property now, and in September we'll start to dig the ground and put wells in, 1,700 wells that will provide the heating and the air to the building, and also provide a tremendous amount of operational efficiency for when the building actually operates. And right now, Shore Regional Medical Center will be the only hospital in the state of Maryland that operates with this geothermal energy. We are targeting summer 2028 go live, meaning we'll be patient ready, patient move in. And so we are already having our teams who will have services in the building start their operational planning. And so what that means is they're looking today at how they operate in their current state, and then looking at the new building and where their space is, how it's configured, what their technology will be, and what will be the same workflows, what will be different workflows. How do we make sure that we don't take our bad habits, but we really process improve and be as efficient and creating the best patient experience and how we deliver that care. We'll finish that officially in November of 2025 this year, and then in April of 2026 we'll actually start our what we call our formal transition and activation. And that's where we get the people ready for the building and the building's getting ready for the people. We'll, as we go further into that is when we'll have the training on the new equipment, making sure that all of our regulatory and licensure inspections have happened and they're where they need to be, so that come day one, which we call patient go live, everyone is confident in how to operate in the new space. So when we have the two entrances that are on the rear of the Talbot County Community Center in October, the front entrance off of 50, right there at the Talbot County Community Center sign, will close down. And that's to enable more of the construction, the relocation of that sign, to create another main entrance that will have stoplights and be really an intersection into both the community center as well as getting onto Medical Center Parkway, which will take you into the hospital. And the goal is to have all of that done again before Memorial Day of 2026.
The donor gave me a note. The anonymous donor gave me a note, and I thought I would, I got it yesterday, or no, the day before, sorry. But I thought that, it's kind of really heartfelt, and I thought, if I could share that, that would be good. She says, having grown up in a small town here, we all know people who had to be sent to Baltimore for serious health problems. Years later, moving back to the area with today's tremendous growth and expansion, patients are often helicoptered to the city. Therefore, this upgraded and enlarged new hospital is badly needed on the Midshore.
Wow.